Hello and welcome to the tip of the day. I'm Dr. Amy Starr with the Mesa Veterinary Clinic, Paws and Hooves Mole Veterinary Services, and San Francisco Stables. And we're helping El Paso help their pets. So today I wanted to talk about basically parasites that you can get from stray pets, or even not stray sometimes, but usually stray pets, and what to watch out for. I'll post some pictures at the end, and basically I thought of this for two reasons. One is in October we were talking about scareaway infection, so we're kind of talking about different types of infection and stuff. And secondly, because I recently had a friend who found a baby kitten and didn't take it in immediately to have it seen, and now her entire family is infested and has lesions all over their skin and are very uncomfortable. And so these things are common. A lot of times we'll find animals and take them into our homes, but it's really best if we're a little bit more careful. We still want to rescue them and bring them in, but the very first thing that you should do as soon as you find an animal is to take it to the vet clinic. The very first day, as soon as you find it, go ahead and take it into a vet clinic, because we can do an exam and look for a lot of those things that can be contagious and hopefully prevent those from getting into your household and onto your family and your other pets. And some things like fleas and stuff can be pretty difficult to treat and get rid of once they're in your household. They get into the carpet and the bedding and stuff like that, and it can be very difficult to get rid of. So you do want to be very careful. The three lesions I'm going to talk about and show pictures of, so the three diseases are fleas, sarcoptic mange, which is a contagious type of mange that's very itchy, and ringworm, which is also uncomfortable and itchy. And all of those are contagious and are commonly found in stray animals, especially baby kittens. This situation was a baby kitten, and a lot of times they have fleas. The baby kittens very commonly have ear mites and fleas, and intestinal parasites and eye infections that humans can get, and all sorts of things like that. And so you definitely want to take them in and give them a home and rescue them, or get them healthy and try and find a home if you can't keep them. But you want to be careful and keep your family protected as well. So the first thing I always do when I bring in a new pet, whether it's a stray or not, I always do a fecal test on it, so a poop test. Make sure it doesn't have any intestinal parasites. That's the very first thing I do. I keep the pet separated in a separate room, preferably a bathroom that doesn't have carpet is a great place, because different parasites and stuff like fleas won't get into the carpet and stay. And so you want to keep them separate, ideally for about 2 weeks. And you want to do that fecal test and do an exam, make sure they don't have any fleas or mange or ringworm or anything like that could be contagious. Once you've done that and you've treated whatever there is to be treated, then you can start introducing them to your other family members and other pets and stuff. But usually 2 weeks is a good time, because anything like parvo in your dogs or upper respiratory infections in dogs or cats, it takes about 10 days, 4 to 10 days for some of those things to be seen and come about. And so by waiting 2 weeks to introduce them, then you know that you're safe, as long as you've done some of the other testing. So in the fleas are obviously parasites. Those are actually very easily treated on the pet with a good quality flea preventative. They're hard to get out of the household once they're in the household, but if you do a good quality flea preventative before you ever even bring them home, usually those will kill the fleas in less than 30 minutes. Some are even quicker than that. And so before you even take them home, the fleas are no longer an issue. So they're not going to get into the household. So that's the best thing to do. And fleas can be hard to see sometimes. They can be very tiny and they can attach to the skin, and you have to look for them like in the ears and around the eyes and sometimes between the toes and things like that. But they are good to treat, or easy to treat on the pet. Don't use a product like Hearts from Walmart. I see a lot of skin irritations and stuff from those products. You want to use a good quality product like Frontline Plus or Revolution. If they're babies, so younger than 6 weeks, then you have to use a topical. Dawn dish soap does work well, but you can't guarantee it's going to get all of them. So you also want to do an actual anti-parasitic, so flea medicine. Also deworm your pets. I know I didn't mention intestinal worms and those 3 that I'm going to talk about, but I always, even if the fecal test comes back negative, I always deworm them before ever introducing them to any of my other pets. So you want to do that. And then going back to the 3 that I was discussing, sarcoptic mange oftentimes looks like little skin irritations or just like dandruff sometimes. And so that can be very contagious to the household, the humans, and the pets. And so that's treated topically usually. There's a couple different treatments, but a lot of times, especially in the younger animals, we do a topical, which is a bath, and it needs to be repeated. And so those pets need to be separated. I rescued a little puppy that had sarcoptic mange, and I basically kept it in my bathtub for about a month while we treated it. And then the last one is ringworm. Ringworm is very common. Kids get it at school, they pass it to the cats give it to the kids, and so forth. So ringworm is a big issue as well. A lot of these won't become a huge super issue if the immune system is healthy, but they can take over, and so you want to watch out for that. Ringworm, it has to, take its time to heal. There's nothing that's going to clear it immediately, but ringworm is actually a fungal. It's not a parasite. It's actually a fungal infection. So antifungals and antiseptics help to clear that up quicker, so like chlorhexidine and bleach and betadine, iodine, and then your antifungals and stuff will help that clear up faster. So I'll post some pictures, but basically, watch out in yourselves if you see any of these lesions of the pictures that you see. Make sure you get to a doctor. Legally, as veterinarians, we can't tell humans what they should be treated with. All we can say is go to your doctor, but there are some things over the counter at your Walgreens pharmacy and stuff like that can help clear up some of these skin infections or skin irritations. And then make sure that you have your pets inspected, so examined and treated before you ever bring them into the house. Hope this helps, and hope everybody has a great week. Bye-bye. So the first 4 pictures are of mange. There's 2 pictures of humans with sarcoptic mange and 2 pictures of pets with sarcoptic mange. The next 3 pictures are of flea bites on humans, and then the last couple pictures are of ringworm on humans. And then also watch our Snapchat, because I recently went to China, and I'm going to be posting pictures this week. Bye-bye.